Traditionally, it's been said that patients beyond the age of 35 should be considered for PGD, but what we're finding recently is that PGD could very well be recommended for patients that are younger than 35 as well. So the main issue is that IVF cycles will often fail because of aneuploidy or chromosomal copy number problems on the embryos. It's definitely the case that women who are 35 and older, have a high rate of aneuploidies, and preimplantation genetic diagnosis is definitely warranted for them. But for women who are younger than 35 as well, you've got about a 30% rate of aneuploidy for young mothers. And so for people who want to make sure that if you've got multiple embryos that look good on day 5 to select, you are very likely to select an embryo that is euploid and is likely to implant and turn into a healthy pregnancy. Preimplantation genetic diagnosis for aneuploidy is warranted there as well. So we see a lot of IVF centers who do aneuploidy testing right across the board. They will use aneuploidy testing for egg donors, etc. I would say that so long as you have enough eggs that have been retrieved, and I would say it's probably around 8 or 9 or more eggs retrieved, and you're very likely to have a number of embryos of reasonable morphology to select on day 5, then PGD is warranted, because you're going to make that decision based on the best information you can, and the genetic information is the dominant effect that impacts implantation rates. For those families who are trying to avoid genetic diseases in their children, PGD is absolutely warranted in all cases, because you are going to select 1 or 2 embryos to transfer anyway, and you may as well make that selection on the best criteria you can, including the genes that you might be concerned about in your family.